One of my very good friend had relocated to Nashik for his job. His father had came to pay him a visit. Unfortunately, one day his father fell off the stairs and broke his leg. Definitely in this condition, my friend took his father to an orthopedic hospital. However, he could do this only after visiting one local doctor and a local hospital which did not treat such injuries. It took him 1 hour and 15 minutes for this entire process to reach an orthopedic hospital which is just 10 minutes away from his place. Imagine the amount of pain his father might have gone through and what all hardships my friend might have faced. To start the treatment, the doctor inquired about his father's previous health record and any other medical condition he had. My friend knew that his father was diabetic, but unfortunately nothing else, like which type of diabetes he was suffering from and what medication he was undergoing. He had to then get in touch with his mother, and even she wasn't aware of the type of diabetes he had. I fairly believe they might have not stored the data well, and even few of the physical records were lost. With the limited information available, the doctor had to rely on his experience and treat the patient, leaving everything else Bhagwan Bharose. The hospital staff inquired to my friend if he can get his father's health insurance details, but he could arrange it only after 2 days, and by then his father was discharged after the treatment. Within 24 hours, as my friend and his father were worried about the spendings. My friend then realized that he could have claimed insurance if his father was hospitalized for 48 hours, and the entire treatment with post medication could have costed them zero. In India, we do not store our previous treatment records, and even if we have them, then those are available in physical form lying in some files or in a plastic carry bag in some corner of the house. Definitely, as those are not in our sight, we do not think of carrying them under such emergency situations like the one faced by my friend. Even if we might have some latest prescriptions, it is in handwritten format which only our brilliant chemist can read. Thus, we can say that entire medical and healthcare sector is based on an informal setup. The medtech penetration is only 10%, while insurance is 18% in urban area and 14% in rural areas. This is due to lack of awareness, access to insurance, and perception of difficulty in claiming them and in understanding them. All this makes out-of-pocket health expense in India at 63%. The Government of India is taking steps towards resolving these issues through ABDM by improving the accessibility, efficiency, affordability, convenience, safekeeping, and timely delivery of healthcare services. It is creating an ecosystem by bringing different stakeholders of healthcare industry on one interoperable environment. In this entire effort, ABHA number or health ID of an individual plays a key role to avail the health services under ABDM. The Unified Health Interface is a gateway that will gather and relay the health data collected from various sources, whether public or private, in an open, interoperable gateway. With UHI, all the data services will be brought together in one universe, and the entire ecosystem will become a data entry and data sharing platform. However, the problem still persists of fragmented data and that of accessibility of various health related data, which will be possible only through various platforms. Though UHI resolves the issue of interoperability, it does not answer the big question of integration. To uplift the healthcare scenario in India, we will need something more than interoperability. And this is where we are building a telescopic super healthcare app, Yorecare. We are proudly building a single access window which is health seeker centric and is crafted to build value for health seeker by creating a health web. This health web will knit the complex information available on UHI and present it to the user in simplified manner to make maximum benefit out of it. Let us see what all you will be able to do on your Care app. Register or link your ABHA number. With ABHA number in place, the care seeker can create, upload or access their digital record and perform activities from registration to treatment to discharge in a paperless manner. You can also access the data uploaded by various stakeholders using your ABHA number, like lab reports, prescriptions, and doctor comments, etc. And it is possible even if the healthcare provider are using other platforms. Yorecare will enable you to search, connect, and avail any ABDM compliant digital health services. Yorecare will also help you to get teleconsultation, home visits, doctor appointments, lab tests, and many more services that in a comparative way by fetching and matching data from various platforms, and thus allowing the user to know various available prices for similar services he want to avail. Yorecare will also help you to get all ambulance facilities under one roof so that you can get ambulances that can reach you at the hospital at the earliest. Yorecare will also help you check which pharmacy has a specific drug available with them without roaming around the city for hours. Hope you can imagine now. My friend would have easily detected the hospital nearby along with its status, like which hospital has what particular specialized facilities, availability of beds and operation theatre while traveling, and could have took his father directly to the orthopedic hospital near his place. Also, he could have easily shared his father's medical history on Yorecare just by flashing a QR code attached to his ABHA ID, and also could have easily accessed the insurance details and reduce his out-of-pocket expense to a great extent. Yorecare, in its commitment to build value for its user, will also work aggressively to provide faster insurance claims by integrating service providers in the field of insurance settlement and claim processing business. Adding one more important dimension is making public welfare schemes reach all eligible care seekers by providing them the information on relevant schemes applicable to individual care seeker. Yorecare user can also shop for their health needs apart from tracking their vitals through various fitness wearables available in the market. Use auto pill reminders which will read prescriptions and set up reminders automatically, and also be able to activate auto answer SOS facility in case of emergency. There is no end to what Yorecare as a single unified platform can do for a care seeker. Come, let's join our hands to create your app that will take your care.